Hi everyone, today we're talking about the current and future use of PBMT. Let's get straight into it because we're going to explain the current use of PBMT as well as the future use in health and medicine, not only for the foot and ankle but also the whole body there. So what's in it for you? Understanding what you can provide treatment for, but also where patients may broadly find benefit from PBMT from other providers will enable clear understanding of the scope PBMT for you, your patients and your colleagues, because it's really important to say, okay, well, here we are treating the foot and ankle, here we are treating the knee, the hip, the back, the shoulder, but this is what we're going to be looking at, more broadly in the scope of where we can potentially be helping people or referring them to another practitioner if it's outside of our scope on getting the best results that way as well. But here we are just looking at, for the foot and ankle in particular, tendinopathies, Achilles, posterior tibialis, anterior tibialis, our perineals, it doesn't matter, jumping up into sort of, around our knee as well. It's going to be tendinopathies more broadly, even jumping up to some, into the elbow, shoulder, etc. A little bit outside of the podiatry scope, but tendinopathies do respond really well. Plantar heel syndrome, whether it is a fat pad atrophy or inflammation, a plantar fasciitis, in with that tarsal tunnel side of things as well. I find fantastic results with pain syndromes, whether it's CRPS, fibromyalgia, or just a chronic pain sort of patient that comes through with these as well. Like I've said previously, mixing that with injection therapy in my case really helps to start stimulating some of that recovery there. Peripheral neuropathy, we're starting to see with our biostimulation type settings that we're finding results with peripheral neuropathy pain that would otherwise not necessarily be getting that. But again, a word of caution here, depending on where that's coming from, chemotherapy induced neuropathy is going to respond a lot better once those medications have ceased. And with diabetic peripheral neuropathy, making sure that their blood glucose levels are optimized is going to be the main thing to ensure that we get them on the right track. But then we start getting into our joint conditions like osteoarthritis. We start looking at our trigger point releases and getting that sort of laxity of the muscles again. Our compartment syndromes, for the few patients that I have treated, I just find that they have such a good longer term outcome from these sort of, an activity-induced compartment syndrome with our laser therapies and PBMT. Fracture healing, we want good blood flow for fractures, and there's, so many areas like around, the fifth metatarsal, which just don't get as much blood flow. And here we have a device and a therapy that can start to increase that blood flow to enable us to get, an increased healing rate. Our inflammatory arthritis and gouts, slowing that inflammation, recovering that area, reducing the pain, again, a really worthwhile option. And that plantar plate, metatarsalgia, forefoot pain, there's all these different areas there as well. We also then start going into diabetic wound healing, surgical wound healing and edema reduction, something that I do quite a lot of. That post-injury edema, whether it's just sort of an ankle sprain, for instance, or a contusion. Lymphedema, just edema generally, really good results, particularly when we start to target those lymph, nodes, to make sure that we're getting as much uptake as possible. And these patients just find such a great response from treatment. We then start looking at sciatica and low back pain, and I do think as podiatrists that we need to be considering this, because unless we are, we're not going to be resolving a lot of their foot pain. And if you're not feeling comfortable, then linking a local health practitioner that is going to be able to provide this as a little bit further. We then start talking Morton's neuroma and other nerve entrapments, whether it's sort of, an anterior sort of compartment type of concern with our descending perineal nerves, superficial perineal, deep perineal, our tibial nerve in our tarsal tunnel, our sural nerves, looking a little bit further and more proximal as well. We then start talking into our bursitis, our burns injuries as well. And as I mentioned previously, those ankle sprains. But where are we talking more broadly in health and medicine? Because there is so much that we can treat with PBMT, and it's really just up to, understanding the right protocols for each of these conditions to ensure that we're going to be able to cover that. And I think, letting patients know that there is an option out there if you're not comfortable doing it within your scope, trying to connect them with the type of another clinic that is able to. And so all musculoskeletal pain, injury and dysfunction can be helped and is evidence to help, with PBMT. And so you really definitely getting on top of that one. Oral mucositis, particularly that chemotherapy induced or radiation therapy induced, these sort of things we're seeing a lot more often as gold standard in prophylaxis of oral mucositis for those that are undertaking therapy. In our major hospitals here in Australia as well, that's gold standard and it's put into place. And so it's really fantastic to start seeing, the public system getting on board with this. That muscle fatigue, in our sporting patients, there's some great studies, and one that springs to mind around foosball and doing bloods and having controls on each team, and the endurance that they found, as well as the markers in the blood showing that they're not fatiguing as much and they're getting better outcomes. They're more likely to continue their sprints for longer. And all of this has sort of been really research driven, as well as what we're seeing in clinic. We've mentioned that lymphedema, a really important aspect for the whole body, whether it is leg or arm. That wound healing, a chronic and acute surgical, that chronic wound healing in patients with diabetes. We're going to cover some of the evidence in our sessions ahead in the next few weeks. But, a decrease of, one systematic review sort of showing that it's around sort of that 67 to 70% decrease in wound diameter. That's huge. And, that accelerated wound healing means that people are going to be the difference between that chronic wound for 2-3 years and cutting through to be able to get them back into, their shoes and activities in their life a lot sooner. And, that mental health side of it, let alone the social side as well, is just huge. But for those surgically, we want increased blood flow, we want increased healing, and this is what we're talking about. Neuropathic pain as well, just the pain burden on society, we can reduce that with PBMT. Nerve entrapments, right through to those migraines and headaches being a really big part there too. Then we go through to sort of, talomandibular with our orthodontics and wound healing within the mouth, different things going that way as well. Age-related macular degeneration, we've talked about burns previously, being a really good way that PBMT can help. Tinnitus, really short session, only several sessions required, and getting really good results, particularly in that sort of idiopathic area. The vertigo, the rhinosinusitis, and for those that have got chronic hay fever, this may be something for you. The trigeminal neuralgia, an amazing amount of evidence coming through, and just hematomas, bruising, those type of things respond quite well there as well. Now the future is really exciting, and I find this really interesting because particularly when you've gone through sort of how it works, this is where you start going, well, the world is our oyster, because it should be in ambulances, and someone do their PhD on it and get the ambulance services on board, because having a wrap, say, over the tibia, when they're in an ambulance, just pull up the pants a little bit, and that's going to increase the free floating stem cells, or the concentration of stem cells in the blood, which can increase that likelihood of repair of sort of the cardiac tissue, the stroke. And we're starting to see some of this research coming through, but not only in that area, but depression, PTSD, again, the traumatic brain injuries. Let's just get some laser onto these people as soon as possible after that instance. Tuberculosis, the nerve regeneration and spinal cord injury. This is really interesting stuff, and they've now mapped how many millimeters per week we're going to be seeing recovery when we're using PBMT versus a control. COVID-19, and this is one of our patients with COVID lungs as such, and they're getting the research out. Although it's early, they're seeing really positive signs for increased respiratory responses after having undertaken PBMT, and less likelihood of needing to be intubated in that earlier stage of COVID. that respiratory conditions can include the asthma and COPD. And so we're starting to see some of these bits of research come out, but we're needing to see a lot more before we're saying this is standard practice. But that Alzheimer's and Parkinson's is starting to get some of their good research there. The heart disease, the glaucomas, sperm mobility, snake bites, but there's really so much more that we're starting to explore and seeing whether PBMT is going to be the right thing for those. But yeah, hopefully this has provided you with some information on, the potential conditions you can treat in clinic. You may also start to find, the general principles, and this is how I want you to think about PBMT by the end of this course, is that, okay, well, if it works for a tendon here, a tendon there, great, it's going to work for another tendon as well. But I want you to sort of generalize these principles to make sure that we're providing our patients with the best outcomes possible. But of course, being straight up with your patients is really important there. But it'll be able to provide you with a greater ability to care for your patients, and often that may be referring them to someone else that it might be outside of your scope to treat this, but using that sort of multidisciplinary team to treat them appropriately is a really good way to go. So every podiatry condition can be improved through PBMT. That's definitely something that I look at. So think about all your foot and ankle concerns. Don't just think feet though. The rest of the body has so many great articles coming out. And I know the chiros, physios, doctors that are joining us, that are really interested in sort of that broader scope as well. And it's a new frontier, especially musculoskeletal, neuroregeneration and psychiatric conditions. But today, that's been the current and future use of PBMT. We'll see you at the next session. Cheers.